So facelift surgery is kind of what we talk about for the soft tissue descent, and that's what we're going to discuss first. Facelifts have become a lot more popular in the last few decades, and that's because I think the techniques for lifting the face have improved a lot. I sometimes meet with hairstylists and hairdressers in my office, and a lot of times they tell me about scars that they've seen from people that have had facelifts, or a shifted hairline, or lots of other things that are kind of telltale signs of facelifts, or a pulled look. People still come to my office every day and tell me that's their biggest fear, is that they're going to look like they had a facelift. And fortunately, a lot of our techniques have evolved so that if they're done properly, it's really hard to tell that someone had any surgery. It just looks like they look good and they look youthful. So anyway, surgery, all these types of facial surgeries are increasing, and it's, I think, mainly because the techniques have improved so much. And the other thing is, people are living longer, they're staying healthy longer, they're staying in the workforce longer, and so that's definitely a factor as well. And I have people come to my office and just say, you know, I need to look good for my job, or I'm applying for a job and I need to look as good as I can. And so that's one of the reasons that we do this as well. So how is a facelift surgery performed? You know, the idea is that we want, again, as I said, to make it look like nothing was done. So we try to make the incisions in inconspicuous areas. Sometimes the incision goes up here in the hairline. Sometimes it goes under the hairline like this, just depending on what the specific patient need is. And I won't get into the details, but there's not a one-size-fits-all approach to facelift. And that's really important that we understand that every face is different and every face has to be handled different. I was trained 10, 15 years ago to make my incision right here, and I don't do that anymore. Now I make it back behind here, and the reason I didn't do that at the time was because there was always this kind of telltale complication where the earlobe, this got pulled forward. And another thing that we've kind of figured out how to avoid, so we can really make the incisions very inconspicuous and difficult to see without causing any telltale signs. Now, the most important part of a good facelift is that it's a muscle lift. If you see somebody that looks like they had a facelift, it's usually because too much tension was placed on the skin. The skin isn't supposed to be tight. It's supposed to be soft and loose, and not so loose that it's sagging, but it's not supposed to be tight. And that's why it looks like sometimes someone's had a facelift. If you address the deep underlying muscles, then you don't have to close the skin under any tension. You can just redrape the skin, and I'll show this in a minute, and just cut off the excess, and there's no tension on the skin. This video kind of shows, and there's some audio, but it's not that important, but I've elevated the entire facial musculature, and you can see when I pull on that, the whole face moves right up to the lip and the nasolabial fold, and the whole face gets lifted, and it actually looks very natural because the face is just repositioned into a previous position in a more natural position. And that's so important to obtaining a good outcome with a facelift surgery. There's that same patient with the excess skin after the muscle's been stitched up. So the muscle is now stitched into its new position, and that skin is just sitting there. It's not being pulled on at all. So I can just go in there and just cut right around the incision, and all of that skin is extra, and the skin that's left isn't tight at all. It has a really natural appearance to it. So when we do this, we can achieve fairly significant improvements, even with a heavy neck like this. We can usually take care of that lack of jawline or loss of definition of the jawline, as well as lift the mid-face, the cheek, the nasolabial folds. All of this, you can see this cheek mound is up higher than it is here. So the whole face has been lifted up, and that's how you can have a normal looking result, is to lift in that way. And then the incisions, her hair's hiding it, unfortunately. This was not intentional, but the incision really is very, very tough to see. And we have pictures on our website, and maybe there's some here that you can see. It really heals really well. Recovery time is about 3 weeks on average, and we have this patient here to talk to you later on if you're around. We get all the sutures out by day 10. And it will initially look kind of pulled and unnatural and tight, and sometimes I have to kind of reassure family members and spouses that they're going to get their spouse back, because and the patient themselves. No matter how many times I tell someone the first time they look in the mirror, sometimes they just say, I'm not looking in the mirror for 3 weeks, and I think sometimes that's a good idea, but it takes a while for the swelling and the bruising to go down. And the bottom line is, if you want that kind of result, you have to do something. And when you do something, it takes time to recover. This is a picture of a lady that I took care of a few years ago. And she, as you can see, looks quite young. But she was feeling tired. She was feeling like she just kind of looked run down. And she's very young, and we kind of talked about all the options. I typically wouldn't recommend a facelift for someone like this, but she really wasn't interested in trying to manage this with fillers and Botox and things like that. And so after a long discussion, I agreed that maybe she was an okay candidate to do a facelift. Excuse me. And I don't think there is a correct or right age for someone to have a facelift. It's a very individual decision, and if somebody has aging features early on, or even if they don't, she doesn't really have that much going on, but she knows that she's not looking like she used to, and after a long discussion I decided that she was a good candidate to do something. And so after we did her facelift, she just kind of has this youthful look that she didn't have before. It's not like she had all these heavy jowls before, but her face has a little bit more of an oval shape instead of a rectangular shape, and she just looks like she's youthful and more energized. And I think this picture, to me, even shows it even more strongly. She almost looks like she went from her 40s to her 20s, just by doing this surgery. And you can see her ear now is exposed. The scar is right here, and then it goes around the earlobe and behind the ear like that. And it really heals very well. You might think this, sometimes people get something called a pixie ear deformity where the earlobe gets pulled down, but that's exactly what she has. That's kind of the shape of her natural earlobe. But the reason she doesn't get that, again, is because there's no tension on the skin to pull that down. So this is actually one of my favorite results, because I think it just makes the point when you lift the face as a unit, it just kind of turns the clock back. It doesn't make it look like you had something done. Just some more examples. This is a 48-year-old patient, and you can see the improvement in the jawline and in the neck and chin area using the same technique. It's also really good for crepey neck skin. This, I think, is a little oversold because it doesn't change the character of the skin. The skin still kind of has that crepey character to it. You can do a laser to help with that, but it does help because it gets rid of some of the extra skin. And I don't know how far out she is in this picture, but I would expect, even with the facelift we're talking about it, 1 or 2 years, you'd start to get some of that crepiness back, and we might need to do something to kind of resurface and try to improve that. I do a lot of men as well. They're a little more difficult to do because we are just difficult. And but this guy, you can just see how sad he looks, and almost just like he doesn't have a lot of energy for life. And his overall, I guess his overall expression and he still looks like the same person, but look how much better he looks with all of that tissue lifted up. The bags under his eyes are gone, and now suddenly he just looks like such a more vibrant. In this picture, I think really he looks energetic, he looks fit, he looks like he's, you know, ready for life, and the other one, he's just kind of on the way down. Here's another example, just with the eyelid surgery, upper eyelids. You can see, you know, and this is something I do even sometimes in people in their 20s. It just depends on how heavy the lids are. But just doing a simple lift of that skin can really open up the eyes and make you feel a little bit and look a little bit more awake and cheerful. This is an eyelid surgery again. It just gives an example of opening up the eyes with that upper blepharoplasty. She also had other surgery. And here's another one of that same woman. And you can again see the jawline's improved, the neckline's improved, the eyes are more open, less heavy. Now let's talk a little bit about volumization. As I mentioned, as we age, we lose the fat in our face, and it's unfortunate I'm in this career because I look in the mirror all the time and think, you're losing it, buddy. I'm losing all my facial fat. I don't have that young face that I used to have, and you can kind of see it right here, right through here. The cheek fat goes. This sags, but we also lose fat here. We lose volume in our lips. We lose volume here. Kind of all these areas gradually lose volume. And so if you combine lifting with volumization, then you really can get an amazing improvement. And, you know, again, she looks kind of older and tired on the picture in the left, and it just doesn't have that look at all on the other one. And here's another view, 3/4 of the same patient, to show the jawline and the cheek being lifted, and also the fat around the eyes. There was no lower eyelid surgery performed. It was just volumization, so adding fat around the eyes. Another example of fat grafting, and you might say, wow, her face is pretty full, she doesn't need fat grafting. And it's true, she doesn't need a lot, but I put it in a few places like the nasolabial folds, these areas here, and that can really enhance the result of a facelift. There's the neck improvement, the jawline improvement with the facelift surgery. Again, you can see the scar there. I think you're pretty hard-pressed to find these scars when they heal well. And here's another one of my favorite results. To me, this was a real dramatic result of someone that just looked, and this is a real active lady who is working and very busy and really involved with life, and just starting to feel kind of tired and run down a little bit on the outside, but not on the inside. And so we can kind of get that youthful face back by doing facial rejuvenation surgery. Same thing here. Again, this is a younger woman, but she was starting to lose the shape of her face, starting to have that more rectangular look. You can see what lifting the eyelid skin made a huge difference for her. And granted, she has a lot of makeup on in the second one and none in the first. But I think people should, I don't mind that in before and after pictures because it just shows that it's not one single thing. It's a combination of things that we do. It's not just the surgery. It's the hair, it's the makeup, it's the volumization, it's so many things. And so if we kind of keep that in mind when we're doing rejuvenating procedures, then it can be natural. If you try to do everything with one procedure, then usually it doesn't look natural. So same thing, 3/4 and side view on her. Another real nice neck improvement.